When you're diagnosed with a long-term condition that is incurable, you only see health professionals for a very short space of time in the course of a year. So you're living with the disease on your own, at home, at work, with your family, with your social life, all of the rest of the time. And if you don't know enough about your disease, if you don't learn about your disease, if you don't learn about the techniques and skills that you can employ to look after yourself and manage your disease as well as possible, then the reality is that your outcomes will be poorer. I don't think that it does. When you're sitting in front of a health professional and you're getting a diagnosis, whether it's for a long-term condition or something that's more short-term, acute, you are worried. You only take in a proportion, and it's quite a small proportion, of what is said to you during the course of that meeting, at the end of which you might not have fully understood what's been said to you. I don't think that just the giving of information automatically leads to an informed patient. Health literacy in the UK is a reading age of about 11 or 12. And so if you are giving people leaflets and pamphlets and stuff about drugs or whatever it might be, if they're written in medical jargon using lots of medical words that the patient may not understand, they're going to take very little of that information in, which is one of the reasons why we as an organisation provide information in lots of different ways and formats. I think some of the material that comes from drug companies or hospitals that they've created themselves can be very dry, very medical jargony, or it can be at the other extreme and a bit dumbed down. And we've worked very hard as an organisation to pitch our written material in a way that is engaging, attractive to look at, something that people would see and they would want to pick it up and look at it. We're also using editors who understand the health literacy issues in the UK and who turn our material that may be authored by us or by health professionals, but they turn that material into short sentences, very clear English, a lack of use of medical jargon, and presenting things in ways that are not threatening. So I think there's quite a lot of work still needed to do in that whole arena about explaining and talking about risks and evidence base around drugs that are being used, especially in a complex disease like rheumatoid, where we have got lots of biologic drugs, biosimilar drugs, and now we've got new oral small molecule drugs coming onto the market. So it's complex for health professionals, never mind the patients. So it's really important that the language that is used is accessible.